Get ready for dictation. 5 seconds. Start. The real time mortality impact of the COVID 19 pandemic is an important statistical measures to guide policy responses, but measuring the actual count is not an easy task. WHO in January 2021 had estimated, based on excess deaths data in Europe and the American continents, that actual deaths were at least 1.6 times over the official count. The problem of undercounting, even in mature public health systems across the developed world, is largely because patients who die due to cardiovascular issues, among others, even after apparent recovery from COVID 19, are sometimes not tracked and registered as COVID 19 related deaths. This is why, even in Kerala, with 100% registration of deaths and a relatively low case fatality rate, following criticisms about the methodology to evaluate whether a death was related to COVID 19, the health administration in the districts, rather than a state level audit committee, will now audit deaths. But there is another class of undercounting across states where health bulletin mislead by reporting a lower number of cases and deaths. This is the case with Bihar, where the reported toll was suddenly increased by 72% following a health department review after the Patna High Court found discrepancies in figures cited by different agencies in Buxar district. Bihar is among the states in India with the lowest civil registration of deaths, with barely 34.1% of the dead being registered. According to the Civil Registration System report of 2018, estimations of the actual count of the death are difficult to obtain in other states such as Uttar Pradesh as well, where public health systems are poor and neither the infections nor deaths have been effectively tracked, especially in rural areas where many have died outside of hospitals. Full stop.